My name is Jamie Feld, Opioid Response Director, and really fortunate to have this panel that's talking about leveraging resources. So this will be a great opportunity for you to hear a little bit more about what state or other resources are available if you are a potential applicant. Also, if you're a regional council, how to braid funding and to see how you might be able to access more funds for your region. Immediately after the session, we're actually going to have a presentation by Medicaid, and that's one area we really want to ensure that folks are aware of is how to make these funds more sustainable for not just 18 years, but really a generation or 2 generations, right? Since we know that the funds are front-loaded. So what I'll do is I'll just go through a couple of slides and then I'll pass it over to our amazing panelists today that we have. We're really honored to have all these folks here that are really the experts on what state resources are. And then we will give some information about where to contact them. And then, of course, all this information will be recorded and available after. So I'll do introductions in a second, but just wanted to let you know about the infrastructure share, which is 10% of the opioid settlements that are coming to the state of Colorado. Right now, we're at $787 million over the course of 18 years coming to the state of Colorado, and 10% of that is going to something called the infrastructure share. So that share is really intended for operational or capital construction that will supplement the other shares. So our state share, our regional council shares. It doesn't have to be capital construction, so that's one question we get a lot. It can be operating. And you can see the recipients that received it in the past. What's interesting about this is it's on a lump sum. So they actually receive it on a lump sum and do quarterly reporting. The eligible entities are governmental entities as well as regional councils. And if an implementing organization like a nonprofit or for-profit wants to apply, they do need to partner with a government or regional council. And the reason is because per the Colorado MOU, which is our guiding framework, all funds have to go to one of these entities for them to be received from the national administrator where the funds are held. So please take a look. Those were the rounds 1 and 2. We're really committed to getting this money out the door as fast as we can. November will be hopefully our next round of applications. And if possible, we're hoping to launch another one with staffing capacity in spring. So a little bit more, like I mentioned, about who is eligible, the purpose of these funds, and also the role of an implementing organization. So start thinking about, if you are an implementing organization, who you might want to partner with, whether it's a regional council or a state partner, or it could also be a local government. The other funds that were just recently announced and then also in existence are some of the ones from our innovation grant, and then also with the impact grant. So 2 rounds of funding occurred that were competitive. I don't know if we have Danielle Holmes here. Oh, here, great. So Danielle is our amazing grant specialist and really is the one responsible for getting these contracts out the door on a timely basis for impact. So really want to thank Danielle. Anything you want to say, Danielle? So we're really grateful to have Danielle to help us get this out. Again, these are the recipients thus far, and we are looking at innovative ways to get it out to more folks. Be sure that you sign up for our newsletter because that's going to be the way you find out about funding opportunities as soon as it comes out. There is also a QR code when you in the networking slide, so take a picture of it, sign up. That's going to be the quickest way you find out about any of the announcements. So I'll just pause for a moment for you to take a picture if you're not already on our newsletter. Excellent. I'll go back one more time. So today we have an excellent panel here. As I mentioned, we've got 4 different leaders that are working on state share funding and have taken time to really present to this audience because we know that we're going to be most effective if we're leveraging funds from multiple sources, right? The opioid settlement funds is one area, but we know that opioids and substance use is a multifaceted issue, right? Mental health, substance use are co-occurring. We know that we need to address this as holistically as we can. So we are really grateful to be joined by Michelle Staley from Behavioral Health Administration, Daniel Culp from Behavioral Health Administration, and Brianna Hurd from the Behavioral Health Administration, all to talk about some excellent programs. And then they'll turn it over to Sam Borden from the Colorado Department of Public Health and Environment. So if you don't mind giving a round of applause to our panelists. And with that, I'll turn it over to our BHA speakers to start, and then we'll pass it over to CDPHE. Thanks again.
One sec.
If I have to ad-lib, these people go without their slides. But essentially, all these slides will be available to you afterwards, too. And we are recording, so we'll get all of our
All right, thanks so much for being here, everyone. My name is Danielle Culp, and I'm the Director of Criminal Justice Services at the BHA. Just happy to share some of our current funding sources, some of the great programs we have currently at the BHA, specifically within the criminal justice system. So I will go ahead and go into some detail about our specifically those programs, and then we'll progressively move into some other spaces and allow some time for questions possibly at the end. So thank you for having me here. All right. So a little bit about our programs. The Jail-Based Behavioral Health Services, I know there's lots of acronyms today, so JBBS is what we'll be referring to, partners with Colorado County Jails to provide effective behavioral health services to incarcerated individuals. They also receive continuity of care services that allows them to enter the community and be placed on that healthy, optimal living track, whether that involves additional treatment, moving into another facility, or perhaps just continuing on their medication regimen and therapy throughout that community. So I'll go into some detail here about some of the funding that is tied to that. Alrighty, so just making sure that, right, so looks like it's just the operator here that's making the errors. So our first, just to kind of give you a breakdown of some of the funding that is involved with our JBBS and MAP programs. Right now, for this current fiscal year, we receive funding from the Correctional Treatment Board. Every year we apply for funding. This year we were in a really good position. We were able to present some data that supported some of our programs. We have new legislation around MAT that requires jail to provide those services. So we were able to hire someone that is able to pull together the data that we needed to support the need for MAT funding and JBBS funding. So right now we're receiving about $9.5 million from the Correctional Treatment Board, and this is for both counseling and medication-assisted treatment for people with substance use disorder or co-occurring SUD and mental health. So this funding here is something that we would apply for every year and propose our funding needs, and of course we would want to have some type of data to support why that is necessary and ensure that we are following legislation. We also have funding that comes from our general funds, General Assembly, and that is about $7.2 million to cover these needs throughout the jails. Lastly, there's lots of legislation tied to all of our specific programs. I can go through all the legislation today, but it would probably take a long time. So these slides will be available to you if you want to go through and look at some of the funding that is tied to these individual programs. One of the things I wanted to mention here was that every year these figures change. We can expect to have funding for JBBS and MAT, but we're not sure what that looks like. So again, we are always doing our best and working individually with our jails to identify gaps and needs as they occur. So as you all know, I'm assuming most of you are familiar with the jail settings and just how those needs can vary, and it's not always apples to apples. Sometimes we have to look at the rural communities a little differently than we do our more urban jails. And sometimes the needs can vary based on innovative technologies or other types of innovations that these jails might want to implement and best practices that are coming through various jails. So we really strongly utilize our JBBS team, Kelly Russell and Rebecca Huckabee, to really just identify what those individual needs are and work with those jails very closely to have a better understanding as to what funding is going to be necessary. So if I give you a breakdown of funding, it would look very different across the state. Right now we have 51 jails participating in our JBBS program, which I think is pretty fantastic. It's taken several years to kind of get to this point, and I think we only have one jail right now that is not receiving JBBS services. So just like to acknowledge that with the current, landscape, how challenging that could be. But 51 jails is pretty incredible. So we're really proud of that. Next, I would just like to call out some of our specific funding gap opportunities. So every year, as I mentioned, we are faced with different challenges. Among our team, we like to look at those as opportunities to really get out into the communities and see what the needs are across the state. This year, we've been very fortunate to partner with our other programs in the BHA, and we are receiving SOR 4 funding, which Brianna will speak to a little bit more coming up here shortly. This is a pilot year, so we are receiving funding this year only and dependent upon the outcomes of how that funding is utilized, perhaps looking at some outcome measures, how the funding gets spent down, and overall just how effective that grant funding is for our jails. So again, I'll let her go into more detail about that timeline and what that funding really looks like. But yeah, this has been a really great opportunity for us to fill some much needed gaps. Secondly, as you all heard this morning, Attorney General Weiser was able to pull his team together and pull some funding together to grant a one-time $50,000 grant to the BHA for 5 jails. The really great thing about this is we were able to work among ourselves and really determine where those needs needed to be met most. It took some time to have our JBBS team come together and look at not only the data, but talk with those jails individually and determine if this funding would in fact impact them and where those needs were. So we're really excited that we were able to be part of this Community Recognition Award. And then we also are working through some funding with the Residential Substance Abuse Treatment Funds, RSAT. And Becky and Kelly did a really great job of working with DCJ, the Division of Criminal Justice, to look at what that funding stream, how that would be implemented, what that timeline would be, and really how those funds would enhance the services that are already within the jails. So again, this is funding for behavioral health initiatives and community reintegration. So it was really easy to, or should be very easy for us to apply those funds to those jails that are currently receiving JBBS funding, because those streams look pretty similar in terms of, or rather the services look very similar that we're already used to, and the jails won't have to make any significant changes in the way they receive funds. There will be some additional requirements through that funding stream in terms of having to do some different reporting. But those mechanisms have already been explained, and we'll be sure to do some technical assistance in the future to make sure that the jails are well aware of those changes. That funding in particular can be available ongoing, dependent upon how those federal awards are awarded, or federal funds are awarded, and how that availability looks across the state. So that's really great news as well for continuity. And then just to give you a little bit of a snapshot of the utilization of JBBS and MAT services across the state, this just shows basically the number of individuals receiving JBBS versus MAT. So as you can see, JBBS is much higher at this point. MAT is fairly new still for several jails, but we expect to see a increase in this because it is tied to legislation and it is required now within jails. So we do feel that this will continue to grow, and how we can fill those gaps is something that we're continuously discussing moving forward. But as you can see, there's a significant need for JBBS services and MAT across the board. And then this just gives you a little bit of a snapshot of our funding breakdown overall. And I really liked that you're able to see over the last 3 years what that looks like. This year we did have the addition of the SOR 4 funding, so we applied that here. But as you can see here, it's very clear that between SUD, mental health, MAT, and SOR, there is some growth, some rapid growth. And with that, we expect that there will be some challenges along the way. Some jails are already expressing to us that they are seeing needs for more complementary services or more innovation, health information exchange, other types of best practices that they're presenting. So we just want to be supportive of all these great ideas and all of these ways in which the jails want to continue to serve these populations. So funding is going to be a big priority for us moving forward. And if I didn't mention it earlier, I don't think I did. The RSAT funding is around $585,000. So that was something that we can expect for FY25, but again, future funding will be dependent on how we spend that down and some outcomes attributed to that. All right, so I'm going to pass this over to Michelle Staley, and she's going to speak about our future funding opportunities.
Thank you. I want to be cognizant of time. So just anticipated funding for FY26. We are currently collaborating with, who you will be seeing after the session, healthcare policy and financing efforts around the 1115 waiver. So we are definitely trying to build in sustainability around that and how we can collaborate with one another. So kind of meeting that long-term demand. And then as Danielle had mentioned before, with regards to the Correctional Treatment Board funding, that is an annual request that is made on behalf of the JBBS programming, and we are currently awaiting the final figures on that for the upcoming year. So no changes for this current fiscal year, but we are awaiting the final numbers for that. So looking again at the sustainability for future funding. All right, I'm going to pass it over to Brianna for SOR.
Thank you. Thanks. I'm Brianna Hurd. I'm the project director for the State Opioid Response Grant at BHA. It is a SAMHSA grant. It started as the State Targeted Response, then became SOR2, SOR3, which finished yesterday. So SOR4 is fresh. Previously a 2-year grant, now a 3-year grant, which is wonderful for us. It's a formula grant, which means SAMHSA predetermines the amount that the state gets. So we don't apply for a certain amount of funding. They look at variables that happen in our state. They look at our overdose rates. They look at what treatment is available, and they come up with that number, and that's the number that we are awarded. And so while SOR 4 year one funding has already been allocated and put into contract, there are several ways for Coloradans to access the benefits of this funding. So I first want to talk about some of our direct services. The mobile health units provide services in our more rural areas. We have 3 providers that contract with our MSOs to provide services. Porchlight, you can see their locations here, as well as San Luis Valley Behavioral Health Group, their locations, and Jefferson Center for Mental Health, soon to be Wellpower. Oh, oops, my bad. Anyway, you'll get these slides, and in these slides, these are clickable links because every provider is required to keep their map up to date. Because stops do change. They change to the needs of the community, what providers are available. We've left communities where we're no longer needed because a buprenorphine prescriber is already or has established a practice there. So that's great for us because the point was to provide buprenorphine prescription as well as some harm reduction services, referral services. So when that becomes established in that community, we're able to move on to another community. If the vehicles, as you can see, they're RVs, if for whatever reason they can't run, our service providers do pop-up clinics and can do telehealth to continue services with the individuals that they serve. And it's been a very successful model. Next, I'd like to talk about our mobile methadone clinics. These are fresh, these are brand new. These are in the Denver urban area. We have 2 providers. We have Denver Health, who has route stops at Westside and Eastside Clinic, and Arts, who has a route stop at Denver Rescue Mission. What's different than the mobile health units is that these actually have methadone on board. These have pharmacy on board. The units, the mobile health units, do not have buprenorphine on board. That's prescribing only. So the individual will need to pick up their prescription from a pharmacy. Dispensing takes place on the unit. They have naloxone distribution, counseling, peer support, very similar services to the mobile health units. The reason I mention these units specifically in this presentation is because of the focus here at the conference on MAT and jails. This is really important for when you're releasing somebody. So if you need to release, or somebody's being released from custody and they need to connect to a community service, this is one of the ways that they continue their MAT. Additional SOR funded services with our MSOs, soon to be BOSSOs, effective July 1st, 2025. We have community reinforcement and family training. This is a support service and group for family and friends of people living with substance use concerns. It's not therapy, it's not a treatment model, it's communication skills and a way to connect with others who are living the same experience as you. We have MAT or medications for opioid use disorder. We are the payer of last resort, or the SOR grant is the payer of last resort for individuals who do not have another way to pay for their medication. They either don't have private insurance or can't private pay or do not qualify for Medicaid. So we can help pay for their medication. And then we have recovery resident scholarships, so that first month's recovery rent we can help pay for through the MSOs, and then of course peer support services also through our MSOs. Some other more meso and macro level areas that you can engage with SOR funding: the Practice Innovation Program, which is out of the CU Anschutz campus, helps providers train in MAT and MAUD prescription as well as treatment. They can help you become a better prescriber, help you become a new prescriber, do training on best practices. And this year we will be working on a forum for adolescents and youth. And then, of course, the Colorado Consortium for Prescription Drug Abuse Prevention has several resources and work groups. They do wonderful work throughout the state, which I'm sure you're aware of. Work groups have been wonderful in pushing new ideas and ways to get the message out about naloxone, about treatment, about recovery, harm reduction. And they also do a ton of legislative work to move substance use disorder treatment and recovery and harm reduction initiatives forward. And then CPC-QC, which is the Colorado Perinatal Care Quality Collaborative. They provide training and practice improvement strategies to Colorado hospitals caring for birthing birthing patients with substance use disorder or substance use concerns. Thank you. And with that, I will pass it over to Sam.
I'm so impressed. You all got through so much information so quickly. Everybody's still with me? I know we ate a bunch of mac and cheese, and now we're talking about money. I get it. I'm very impressed that you all are here. So my name is Sam Borden. Pronouns are she, her. I'm the Harm Reduction Grant Fund Manager at the Colorado Department of Public Health and Environment. And I will be covering, oh, yeah, I do, thank you. Oh, I think it's up already, thank you. I'm just gonna switch to the next slide. I'll be covering primarily the programs that are under the Overdose Prevention Unit, which is where my program and other programs that you may be familiar with are housed in CDPHE. But bear in mind, I could probably give a 30-minute presentation on every single one of these programs. So I'm not gonna do that, I promise, I really do. I am gonna go fairly quickly through some information. If there are questions that you have, please feel free to come and find me and we can talk more about the programs that we do offer. Ultimately, a lot of the work that we do is kind of trying to procure resources for the individuals, the communities, the organizations that are doing the work, the direct service in the community, and kind of get out of the way, provide technical assistance, support. My job is not glamour. It is hopefully just trying to make things a little bit easier for the folks who are really doing the hard stuff out in our communities. So I'm gonna go ahead and just kind of go down the list of some of our programs. I'm gonna spend the most time on the naloxone bulk fund, which you may have heard of, I don't know, because I think we have a lot of questions there typically. But just to start off, we have the Coroner Project. It's a mini grant program. So that's open funding, it's non-competitive, it's first come, first serve. We encourage coroner offices across the state to apply for additional funding to pay for toxicology testing for opioids, for stimulants, for any other substance that may be affiliated with an overdose death. This is something that we have about 35 recipients for right now, and we're always looking for more participants because we know that, well, death certificate reporting isn't giving us the most timely information about what's happening in our drug supply. It still provides some really important information about what we're seeing in Colorado in terms of the primary causes of both fatal and non-fatal overdose. I'm gonna try and say this whole acronym beautifully. Our comprehensive opioid, stimulant, and substance use prevention grant through the Bureau of Justice Assistance just ended, but it was a great program that had 9 recipients, most of whom were in rural Colorado, and they really helped to create recovery opportunities and other resources for individuals in areas that didn't typically have them to begin with. Notably, 2 recovery/sober living homes were opened in Lamar, Colorado through this grant project, which was incredibly impactful. My program, which I'm a little biased about, but I won't spend extra time on, is the Harm Reduction Grant Fund program. So there's 2 kind of arms of this. The first started in 2019. It is the first state funding of its kind that focuses on harm reduction and specifically trying to keep individuals out of the criminal legal system who are struggling with or using substances, and really kind of trying to get that funding into the community to attempt to use evidence-informed methods to support people who use drugs and the people who love them. We have 13 projects under this grant. The first 5 are through our original grant fund, which started in 2021. And that project will end at the end of this fiscal year, so June 30th. We also received American Rescue Plan Act funds to extend that program to another group of grantees who are also going to be having that funding opportunity for 3 years. So we've had some really amazing work done. We have grantees in this room, I see you, who are providing harm reduction services, who are providing services to people who are currently incarcerated, providing diversion services, providing access to treatment, peer support, all sorts of innovative practices. And a lot of that work is driven by what the community really needs. So my heart is there for sure. Our Overdose Data to Action program is funded through the CDC, Centers for Disease Control. I almost called it Colorado Disease Control. It is not. We have 10 current recipients, so we just started a new round of funding. And so we have our program manager in the room as well, who managed that with 2 other colleagues. We have a harm reduction arm of that and a linkage to care arm as well, and so that is federally funded. That's going to be a 5-year term grant. It funds a number of different interventions: public awareness, community education, provider education, surveillance. A lot of our data is also funded through that OD2A, and so is our corner mini grant program. And then finally, on this slide, before we go to the next, we do a lot of collaboration with the Office of HIV, STI, and Viral Hepatitis. They are amazing partners at CDPHE with us. They work in tandem with us, kind of trying to support our syringe service programs, our harm reduction organizations. They currently have 35 local public health departments that they're providing free fentanyl test strips to, and a lot of really important technical assistance as well. And so they've provided about 246,363 fentanyl test strips to LPHAs. And those LPHAs then are in a position to give those to anyone in the community who feels like they can put them to use to prevent overdose and reduce risk. Perfect, thank you. Oh, I guess here's that slide. It's not your fault. Okay, so we're gonna go ahead and jump into the bulk fund. And it looks like at the time I must be talking very fast because we still have quite a bit of time. Look at me go. I'm gonna slow down. All right, so the naloxone bulk fund is probably one of our most well-known programs because it has created an opportunity for a lot of different organizations across the state to receive naloxone at no cost. I'm sure that most of you, if not all of you, know what naloxone is. It's an opioid antagonist. It's been around since the 1970s. It can be used to temporarily reverse the effects of an opioid overdose. It is life-saving, and up until just a few years ago, we really struggled to get it in the hands of people who needed it most. So the Naloxone Bulk Fund and my team, who is also here and does amazing work, has done a lot of work to try and get this to the organizations that need it so they can get it to the folks who are really responding to overdoses in our communities. This fund was created in 2019. It provides naloxone for free to eligible entities. Originally, that list of eligible entities was pretty short. But in 2022, the HB 221326 bill did expand that list of eligible entities, increasing those folks who could access the fund. Unfortunately, we don't have an annual appropriation that allows us to continue providing naloxone on the same scale that we have in the past. So, you know, it's a mixed bag. One, on the plus side, we have a lot of demand for this tool. You know, back in the day, when I was doing a little bit more direct service work, sometimes it was really hard to get buy-in for naloxone, and now we have people clamoring for it, and that's wonderful. However, that does pose an additional challenge of making sure that we're meeting that demand. So we've really been lucky to have a patchwork of funding over the years to kind of rise to meet the need, but we've had to be adaptable in making sure that we can continue to keep this fund going. Some of you may be familiar with the prioritization plan that we just implemented. I'm still on the same slide, I don't want to get ahead of myself. All right, we're good. So this prioritization plan just seeks to ensure that we're really maximizing our resources and getting naloxone to those who are most likely to respond to an overdose. We know from evidence and research that that is people who use drugs and people who know people who use drugs. We know from nationwide studies that anywhere from 80% to 90% of people who respond to overdoses are people who are also using drugs or in close proximity, family, friends. So the way the prioritization plan is tailored is it's working with specifically organizations that are most likely to interface with those individuals. We know that when we have the ability to do so, giving naloxone to the general public, to first responders, people who use drugs, this is incredibly powerful in reducing overdose. But we also know that when we have to cut down, the most impact is going to occur if we can continue to get it to people who use drugs and those who are in their general orbit. So that's really the justification behind that prioritization plan. It's been a hard road to roll it out because obviously we want to have t-shirt guns full of naloxone, just getting it to everyone who could ask for it. And maybe at some point in the future, that's where we're headed. But we continue to adapt, like I mentioned before, to make sure that this fund continues and that it doesn't go anywhere, and that we can continue to provide this important resource to the best of our ability to everyone in the state of Colorado. So just to give you an idea of what our last year looked like, so this is our fiscal year 2023 to 2024, we provided 519,303 doses of naloxone to 506 agencies in all 64 counties. So it's a pretty reasonably large amount. We know when you give people naloxone and they give it to people in the community, they save lives with it. That's pretty impactful. We saw a 36% increase in doses distributed over the past fiscal year. We spent $11,304,933. I said that in a strange way, but you get my drift. In fiscal year 2023 to 24. That is not a small sum. This number represents spending prior to our implementation of the prioritization plan. So no limits were on requested amounts, and there was no cost for any eligible entity. So that's, kind of peak utilization. We had some impactful changes where we had over-the-counter naloxone get approved. We saw more saturation for folks to go out and buy it on their own, but we're still seeing kind of just what the general landscape is going to look like when we find out how available this will be to the general public, how accessible it will be price-wise for the individual, and how funding statewide and in counties will look as the years go by. Our current monthly spending since the implementation of the prioritization plan is about $589,000 plus per month. So $500,000 will allow us to provide to high need and essential agencies, those are 1 and 2 on the prioritization plan for a month. So it goes quickly, and it's incredibly important, but just want to kind of illustrate that it's a larger number than you think. So just to give you a sense of some past and current funding, and it looks like we're gonna have some time for questions, which is great. So during the 2022 legislative session, the General Assembly allocated $19.7 million in one-time American Rescue Plan Act funding to the bulk fund, which is wonderful. This increased availability and our ability to give out naloxone across Colorado. This was also where the list of eligible entities was expanded, and we saw a substantial increase in requests for naloxone and distribution across Colorado. We also receive an annual appropriation of $160,000 in general fund dollars. This is our only permanent source of funding. And this is for our admin. So this is for our team that administers the program, make sure that the program works and gets naloxone where it needs to go. So we've really managed the bulk fund over different conditions for quite some time. We use multiple federal and state funding sources, and I'm not going to list them all out for you because that seems like it might really push the mac and cheese over the edge, but you will get access to these slides if you're curious. We also just recently were provided with additional notification of funding from our friends here at the BHA, which is going to be incredibly helpful in ensuring that we can continue getting this important resource to individuals who need it, specifically those who will be in a position to respond to or might be in a position to experience an overdose. You can go to the next one. And I believe that is it. So I'll pause for questions. If you do have additional questions after the fact, do please feel free to email me or our general email if you want to roll the dice on who you get to talk to. But like I said before, we really rely on our partners across the state to do this important work, and we're really honored to get a chance to work with them and try and reduce barriers as much as possible.
And before we open it up to questions, first, thank you to our panelists. A round of applause. And one thing that our office is committed to is working with our state partners to see where there might be gaps. And so we've been really grateful for folks here at this table, others that are here, that have let us know when there are gaps so that we can figure out how we can work together. And so one of those is with naloxone bulk purchase, looking to see, because the BHA is looking at partnering, that the AG's office could also partner in summer of 2025. So we know that that's still not going to be at the level of 19 million, right? 19 million coming through ARPA is a lot. We don't have that much for the state share over multiple years. So we know that we're not going to have the same level of naloxone distribution as we previously did. And so we are going to still have to look through the prioritization plan and how we can most meaningfully get the naloxone to those that are most impacted first. But our office is looking at how to work hand in hand with state partners. I come from the local level and know it doesn't make a lot of sense at the local level where these funds are coming from. You just need to get the services to your people, right? Why it's so critical that we, as partners, work behind the scenes to try to make it as fluid as possible. So I just wanted to state that commitment. I know there's going to be a lot of questions, but first wanted to see if anyone from our panel first wanted to mention anything that they've seen as effective for partnership between state agencies. I can just go one more, is that one area that the BHA was really committed to was letting us know ahead of time who might be potentially recipients of funds and us communicating as well, so that we're understanding how we're not just in the dark funding, but we're really working collaboratively to have a holistic form of care. We also had it as a requirement for one of our rounds of state funding. Have you talked to the BHA? Have you talked to your RAE, your regional area entity? So we have our Medicaid partners. Are you thinking about sustainable funding for your organization? And making sure that as much as possible, our grant agreements or our grant, for example, with JBBS, are similar to what we're doing for the MAT and jail awards, right? So that they're not going to have to report to two grantees in different ways. And so as much as possible, we're trying to think through how to make it effective. I guess we could take a question. Mark.
That's an excellent question. I think your question brings me back to, 2014, 2015, where we were really, really working to get pharmacies on board with here's how getting people naloxone works, here's how insurance works, talking to, participants at, could be a syringe service program, a local public health department. Those still stand, right? We have these local resources and connectors, not always the same in each place, right? Every area has different challenges, but we have these avenues where we can absolutely get someone connected to Medicaid or provide information to them about, hey, your copay is $0. You might have to pay $1 for an atomizer. How can we help you overcome this? That's one element. Certainly, we talk to different organizations about what would it look like for your leadership to invest in having this as part of your budget for a larger organization. Because now that there's intergovernmental agreements nationwide, there's organizations like Remedy Alliance who are really trying to lower barriers for organizations to access naloxone at a lower price point. So those are areas as well. And, you know, talking to the folks that you interface with, regardless of where they kind of fall in the economic scale or the insurance scale, about their different options. Because they may not know to the degree that we do that naloxone is over the counter, or they may be going to the pharmacy and their pharmacist may not know, hey, I can still let them use their Medicaid even though it's over the counter, so they can get it for free. So I think that's a great kind of stepping back to our original tactics to help fill those gaps that we're seeing, I think is really important, because it's really wonderful when we can saturate with free naloxone and it's really easy. But when these challenges arise, it's always good to turn back to our scrappy roots of, you know, find our partners, really build those connections, lean on, you know, our pharmacist friends, build education, and empower community members to know exactly what their resources will get them, and linking them to what they need. So thank you for the question.
Okay, we'll take that question on the right. Oh, go ahead. Well, so right now, go ahead.
Two different contractors. So anyone that's in community, Medicaid, it's not so much a grant program as that you would contact, and I'll help you afterwards, contact your local MSO and figure out how you build a contract relationship with them. Here's how many uninsured people we serve, and then make sure, obviously, Stout Street Fund, make sure you're a Medicaid provider or work with a local Medicaid provider, because Medicaid covers it too. Okay?
Okay, and as a just a caveat there, the funding that we spoke to about, like RSAP funding, is that what you're referring to as well? So as of right now, it's specific to the jails, but this is our first year. Actually, September 16th, we just shared that information with everyone, and currently we only have 6 weeks for for jails to apply to that. So right now that is very introductory. This is our first year really tapping into those funds, but if you're ever interested in like having these discussions, even like best practices, sharing all sorts of different trainings and programs, you're more than welcome to reach out to Becky or Kelly from our team. So we could give you that information.
And I think we actually are, I'm getting told we're at time, is that right? But what I wanted to make sure is that we do have everyone's contact information here. And also, these folks, if you want to raise your hand just about who you are, that you're working for the state agencies, you can come and talk to folks after this meeting. And then they're also very accessible when I've reached out to people. So we wanted to make sure that this information is available for you all. And then please reach out to people directly, because we want to ensure that you have it.